Now, you're watching Wave 3 News Listens Live
And it is a celebration.
with your host, John Ramsey.
Welcome into the Monday edition of Wave 3 Listens Live. Hope you had a fantastic weekend. For all the moms out there, I hope you enjoyed your Mother's Day. Let's take a look at the rundown. What's going on today? You know that your home is your most valuable asset. If you have water issues, you need to take care of those. And Sean and Luke are here to tell you all about Champion Waterproofing. I want to remind you they are locally owned. Do business with these guys. They're fantastic. Kaufman and Stigger injury lawyers are here, and we're talking about bicycle safety today. And if you need an orthopedic doctor, then you need someone who has experience. You need someone who has cutting-edge technology. You need someone you can trust. You need Ellis and Badenhausen. With us now is Brent Norton, who is with Ellis and Badenhausen Orthopaedics. Brent, welcome into Wave 3 Listens. Before we get started here with how you guys are handling business, a little bit of an overview. I know you have a very rich history.
Yes, well, we started in 1954 with Dr. Rudy Ellis Sr., who started the practice, and then Dr. Badenhausen joined in 1969. So we celebrated our 50-year anniversary last year, and we've never faced a challenge like we have this year.
Yep, so let's go ahead and get right to it then, Brent. This coronavirus, this pandemic, it's been quite the crisis here, and every business is different. You have to adapt to survive. So tell me how your office and how it's changed. What's going on right now in the offices, Brent?
So the governor let us open up without restrictions this past 2 weeks. We've been open the entire time, but during the crisis, we had only cut down to urgent qualifying injuries only, so fractures, post-surgical care. Now that we're open, we've had to revamp the office entirely, get rid of our waiting room, which is a challenge in healthcare. If you've been to the doctor, you're usually waiting in a waiting room now. Now it's everyone's dream. You come right in, you go straight to a room, and you see the doctor within 5 minutes.
Brent, because of the success you've had, the positive outcomes, you have offices both in Indiana and in Kentucky. The rules in each state are a little bit different. So as executive director, is this a challenge for you, Brent?
So yeah, those challenges are every day. We're listening to 2 different governors. We're listening to the rules of Indiana and obviously of our home state, Kentucky. When we go to do surgery in Indiana, we have to follow the rules of that governor. And while here under Governor Beshear, we're following his lead in all those guidelines. So if you're at our Norton Women's and Children's facility, you're going to get COVID tested prior to your surgical procedure. While in Indiana, we don't have to follow those same guidelines.
Okay, Brent, so now that they're allowing elective surgeries and you have offices, as I mentioned, in Kentucky and Indiana, how about scheduling conflicts? That has to be quite a challenge. Tell me a little bit about your scheduling now. So
when we first, the crisis occurred, we were pushing everyone out about a month on appointments, so we kind of stockpiled our office. Now we have to go through, re-scrub it again, and spread patients out, because we can no longer see the volume that we used to see, because we can only allow you in, immediately see you, and then have you exit the building. So we're constantly in contact with our patients, both surgical and appointment-based, letting them know this would be your time, and like we said, you're just going to come in, safely, securely. Obviously, our staff's safety is utmost concern to us, so we looked over every procedure, how we see a patient, what are the critical areas that we need to be concerned about, and then just communicate to the patient as well so that they feel safe as they come back into the community.
Your industry is interesting, not just the healthcare industry, but orthopedics specifically, because I'm curious about how it changes moving forward. Obviously, you mentioned some of the changes now, but as we move forward, do you see maybe some of the things you've implemented, some of the initiatives that you've implemented remaining with you, Brent, as you kind of look at your practice with different eyeballs, right? Yeah,
we've re-examined from the way you call all the way to the end, how we see you, and changed a lot of the way we do business. It used to be you would come wait in our waiting room and wait on our physician. Now we're very concerned about patient time. We always were, but it's just a different dynamic now, so that instead of waiting on our doctor's waiting on you, and prioritize your time and your safety as well as our staff safety. So we're re-examining that, the use of telehealth. We've incorporated that. I mean, that was like going to the moon in 2 days, to incorporate telehealth and get physicians up and running and get patients up and running. So we've incorporated that in the office, as well as getting rid of paperwork. We're now doing it electronically, sending it to you and let you filling out ahead of time.
Interesting. I'm curious about the procedures that you offer. I'm not curious. I'm actually informed thanks to you. But I was reading up on all the things that you offer because when I think about orthopedics, I think about joint replacements, knees, hips, etc. But it's really much more than that. I know you handle the rehab, but as far as your services are really extensive, aren't they, Brent? Yes,
so we offer obviously physical therapy along with our physician office. We consider ourselves one of the leaders in sports medicine. These past 50 years, incorporating working with the university, the Louisville, the Bats, Bellarmine University, but also as people get out and are moving around and the weather gets nice, you know, your bumps, your bruises, your aches, we see all of that. So if you're out, start walking more, you notice your knees bothering you, we're here to help you get through that process.
You know, Brent, something you have to be proud of. Obviously, you know, when I mention the name Ellis and Badenhausen, everyone's familiar with the orthopedic work that you do. You've got to be proud of that. But I mentioned also when you're looking for someone with knees and hips, you want, or any joint for that matter, or any matter of health, you want someone who is really cutting edge technology, who keeps up with the latest trends, knows exactly what's working, what's not working, the latest advances, and you do that as well. So really you've got the best of both worlds. Talk a little bit about that and the importance of.
We do, and the downtime during this whole COVID crisis, we were actually researching new technologies on how we're going to implement it within the office once we were open up again. So whether it's, you know, ultrasound guided injections in the office, PRP injections, anything that we can improve a injured patient's lifestyle and get them back to their normal function, we're always looking at, examining at, and researching thoroughly so we can incorporate those within our office.
I think this is interesting information. So I'm going to go off script here, Brent, because I know you can handle it. So, you know, I'm a big sports fan. A lot of folks that live in Wave Country are big sports fans. How has your business changed in that regard? You do handle a lot with the University of Louisville. You mentioned the Bats and other sports teams. So how have things changed for you now that sports has completely changed?
Well, we're not seeing as many sports injuries. And maybe in the long term, this will help some of our youth athletes who play constantly throughout the year. You know, baseball, we see a lot of shoulder injuries, overthrowing injuries. You know, those athletes are constantly playing. Well, maybe this COVID blip here, we hope it's just a blip, will slow that volume-based injury situation we were seeing. You know, they're not out throwing, they're not playing 5-6 times a day anymore, 3 to 4 games. You know, it's a little respite for those overuse injuries that we've seen. So we're not seeing that. We're seeing the person who has not been active, who's now getting out active. We're starting to see those injuries more. It's a different dynamic within the office, but we try to take a negative and make it a positive, so maybe those youth injuries of constantly playing will slow down.
So in terms of recovery, some of this is actually good news because maybe folks aren't going as hard or as long as they had in the past. Interesting, especially athletes, you know, the top tier athletes not probably practicing as much, right?
Yeah, rest is always a good thing, but too much rest can be a bad thing. So you're kind of playing with both dynamics.
For those who maybe have been delaying a surgery, perhaps they have a shoulder, maybe a hip or a knee, and they've been delaying that now. Is now a good time to give your offices a call, or should they, if they can, put it off?
It is. So we're stratifying based on risk factors right now. So depending on age, depending on different diseases you may have, we would run through that gamut and see where you qualify to have surgery. You're dealing in a world where many people are out of work and they're actually calling to have a surgery done because they know they're going to have to go back to work right away. And while they're not working, this seemed to be a great time for them to do it. So we're putting some people off and we're trying to get some people right on. So we're happy to screen any patient who wants to call the office. We'll talk you through the process, talk you through the safety protocols that we're doing at the office, but mainly at our hospital and surgery center as well. We know we're great partners with Norton Women's and Children's. You know, they've done fantastic work over there serving the community. So we just want to reassure everybody of the safety precautions everyone's doing right now.
Brent, before I let you go, so if folks would like to schedule an appointment, call the office. If they want more information, do you have a lot of information available on your website there?
Correct. You can go to our website, enbortho.com. Obviously, call us at any time, 502-587-1236. We're happy to help you. We're happy to talk to you and walk you through the steps.
Brent Norton, once again, the Executive Director of Ellis and Badenhausen Orthopaedics. Brent, thank you so much for your time. Very informative. I enjoyed it. Thanks so much.
Thanks for having me.
All right, coming up here, it's that time of year. Beautiful outdoors. Great day for a bike ride. So grab your bicycle helmet. Don't forget the helmet. And we're going to talk to Kaufman and Stigger about bike safety next on Wave 3 Listens Live.